Hello and welcome to the updates on COVID-19 from Tokyo. Japan extends calls to avoid nightclubs and bars to all prefectures throughout Japan. Japan will allow governors of all 47 prefectures to strongly request that their residents refrain from visiting nightclubs, hostess bars, and busy downtown spots in a push to prevent cluster infections of the novel coronavirus, Prime Minister Shinzo Abe said on Saturday. During the meeting, the government revised its basic policy to fight the virus so that the governors of the 40 other prefectures can issue the request in a stronger fashion. Seeking that the reduction in commuters to work now is still not enough, Abe urged business in the 7 prefectures to basically practice working at home. Should there be a need to go to work, commuters are to be reduced by at least 70%, he said. The Prime Minister has been calling for reducing person-to-person contact by as much as 80%. Tokyo confirms daily record of nearly 200 coronavirus cases. A total of 197 new coronavirus cases were confirmed in Tokyo on Saturday, a record daily increase for the 4th straight day, the metropolitan government said. Of the 197 infections confirmed Saturday, 152 or 77% had no clear infection routes. There were no deaths reported and none was seriously ill. Nationwide infection cases rose by more than 680 to over 7,500, including about 700 from the Diamond Princess, a cruise ship that was quarantined in February near Tokyo. The death tolls stand at 141. Japan to allow first-time patients to receive medical services online. In a bid to protect hospitals from the coronavirus, the Health Ministry will allow first-time patients to receive medical examinations and be prescribed medicine online or via telephone beginning next week, the Health Minister said on Friday. Patients who choose to receive such services will also be able to receive prescribed medicine at home by using a courier after being given instructions on the use of drugs from a pharmacist over the phone. First time, patients will be allowed to receive medical services online or over the phone or as long as the current pandemic continues, but will have to see a doctor in person to be prescribed medicine after it ends as currently required. The Health Ministry has tentatively set an online consultation fee for first-time patients at 2,140 yen, with patients paying up to 642 yen, depending on their types of health insurance, ministry sources said. Softbank CEO says he will supply 300 million masks per month to Japan. From next month, Softbank will supply 2 different kinds of masks, initially for medical staff in cooperation with the Japanese government's mask team set up to tackle shortages due to the coronavirus outbreak, Son said on Twitter. The government is also targeting domestic production of 700 million disposable masks. Softbank supply will consist of 100 million N95 masks which can filter very small particles and 200 million regular surgical masks. The coronavirus pandemic has spurred Son's return on Twitter, where he has complained that Japan's response is being spearheaded by politicians rather than scientists and polled users on the review of government's response, adding to pressure to increase social distancing measures.